Welcome back. Now, moms, because you're in charge of your family's health, you will hear firsthand from other moms about their experiences and get expert advice from a specialist. 1 in 8 women are diagnosed with breast cancer, and each has a compelling tale to tell about how their lives were changed by it. Please welcome to our show Bonnie Grant, Michelle Nicastro, and Linda Corley, and the chair of surgery at Fox Chase Cancer Center, Dr. Monica Morrow. Welcome, everyone. You actually were wheelchair bound because of your cancer.
Yes, I had had breast cancer that had spread to my spine. It collapsed a number of vertebrae. I lost 4 inches of height between here and here. And I couldn't walk. I was in a wheelchair, and then went through treatments, and eventually I learned to walk again.
And you had to take care of 2 children.
Yes, I have an 11-year-old and a 14-year-old. This was 3 years ago, so they were even younger than that then, obviously.
And Bonnie, you actually had a mastectomy.
I was diagnosed with invasive ductal breast cancer about 7 years ago. I had a very large lump, so they did preoperative chemo first. Then I had a mastectomy and immediate reconstruction, followed by another 6 months of chemo and radiation.
And you also have 2 sons?
They were 12 and 14 at the time of diagnosis.
And we're going to talk about how they went through that with you. And now Linda Corley is here. She just had a mastectomy 2 weeks ago, and she's here with us today. Linda, you had a different kind of cancer.
Inflammatory breast cancer.
And just a year ago, Linda was on this show, roller skating for us, and soon after that, you went through
6 months of chemo and the surgery, and then I have to go through radiation.
You had a mammogram, and it was not detected.
Yes, and the ultrasound, it wasn't detected. It was detected through the biopsy.
So, Dr. Morrow, you don't particularly find a lump all the time.
That's true. Instead of a lump, it presents with a redness and a swelling of the breast. It looks like infection. If you're being treated with antibiotics for a breast infection and you're not nursing and it doesn't go away within a week, you need to see a surgeon to get checked for inflammatory breast cancer.
And that's a biopsy.
And that's a biopsy.
It's a lot for a child to go through watching their mother go through breast cancer and radiation chemo and even losing their hair. So how did you handle it with your children, Bonnie?
From my perspective, I had to be very frank with them. You know, we all needed to deal with it as a family. We did seek some family counseling. They did act out a lot with each other.
Looking back, what do you think the best thing you did to address their concern and the way they were acting out?
Getting into family therapy and going on with our routines.
And how about you, Michelle, with your children?
Well, I mean, it's obviously devastating to look and see their fear. I think it's really great to teach them that you can get through anything is such an important lesson in this life, because boy, does life throw you curveballs, and you have to be able to handle them. Because when I was lying in that hospital bed and I couldn't walk, I didn't miss singing on a stage from my past career. I missed packing my kids' lunch. I missed putting them to bed at night. I missed the normal things that I did every day by routine. And we said, you know, how do we get the message across to people that's those simple little things that if you didn't know if there was a tomorrow that you would miss?
And you developed this incredible line called trulymom.com. And you have day planners.
And it has an address book, and it's pads, a Post-it note, and a calendar. And we donate part of our proceeds to breast cancer research.
And Linda, you are here after just 2 weeks of going through surgery.
I'm here to share with other women that you can beat breast cancer. Don't let breast cancer beat you.
What do you think? Yes! Doctor, are there any misconceptions?
Many women still believe that if they don't have a relative with breast cancer, that they will not develop breast cancer. And unfortunately, that's not true. About half of breast cancers occur in women with nothing we can say is a risk factor. It's a common disease. The good news is progress has been made. In fact, the way we're going to find better treatments and hopefully ultimately cure cancer is through research.
And thanks to so many people in our audience today, we are getting funding for that research. And just remember that early detection can make all the difference.